Hello everyone, myself Bushra Sayyed, Assistant Professor at Department of Zoology, CUSHA Institute of Science, run by CU Ronak Foundation. Today I will be explaining about the conduction system of heart, which is the subtopic of Unit 2, Cardiac Anatomy. It is one of the important topics from exam point of view. So let's begin. First of all, we should know what is conduction system of heart. In simple terms, it is how the heartbeat is generated and spreads throughout the muscles of the heart so that it can perform the perfect pumping of the blood. Precisely, it is electrical conduction system in which electrical impulses are generated which results into the formation of action potential. Therefore, an inherent and rhythmical electrical activity is the reason for heart's lifelong beat. So the conduction system comprises of autorhythmic fibers. As the name suggests, they are self-excitable, which means they do not require any signal from nervous or endocrine system to function, unlike any other tissue of the body. That is why the heart continues to stimulate the beat even after it is removed from the body. The autorhythmic fibers generate action potentials that trigger heart contractions. Now, what are these action potentials? Action potentials are generated whenever there is a change in the membrane electric potential or membrane electric charge, and here this change is done by autorhythmic fibers. During embryonic stage, 1% of the cardiac muscle fibers become autorhythmic fibers. So these relatively rare fibers have two important functions. The first one is the pacemaker, which sets the rhythm of electrical excitation causing contraction. The second one is the conduction system, which will carry the signal generated by pacemaker through a network of specialized cardiac muscle fibers, due to which the heart will be pumped in a coordinated manner, resulting into the progress of cardiac cycle. Cardiac cycle is basically the systole and diastole of atria and ventricles of the heart. Now we will one by one have a look at these fibers. First one is the SA node or sinoatrial node, which is located in the right atrial wall just inferior and lateral to the opening of the superior vena cava. The automatic generation of electrical impulse is the spontaneous depolarization which leads to the generation of pacemaker potential. This pacemaker potential is now converted to action potential and propagates throughout both atria via gap junctions in the intercalated disc of atrial muscle fibers. Therefore, the atria will contract, resulting in the atrial systole, that is, the filling of atria with the blood. This action potential is now carried to the next fiber, that is AV node or atrioventricular node, located in the interatrial septum. From AV node, the action potential passes into AV bundle or bundle of His. Remember that bundle of His are the only fiber which could transfer the action potential from atria to ventricles. The AV bundle divides and carries the action potential to the right and the left bundle branches, which extends through the interventricular septum toward the apex of the heart, which are now followed by the final Purkinje fibers, which will supply the action potential beginning at the apex of the heart upward to the remainder of the ventricular myocardium. Therefore, ventricles contract, resulting into ventricular systole or ventricular filling. Now, we will see diagrammatically how these fibers work. The first one here you can see is the sinoatrial node located in the right atrium attached to the lateral wall on the upper side of the superior vena cava. Here you will be able to see that the arrows coming out, it means that the action potential which is generated in the sinoatrial node will be passing to the left atrium, resulting into the contraction of both the atria, and therefore the blood will fill in both the atria at the same time. In the next manner, you can see that sinoatrial node passes the action potential to the another or the second fiber, that is the atrioventricular node. The atrioventricular node supplies the action potential to the bundle of His, and the bundle of His, as you can see here, it divides into the left and the right bundle branches which will extend to the apex of the heart. From the bundle branches, you will be able to see these fibers or the branches coming out and entering into each of the ventricle, which means that these Purkinje fibers will be supplying the action potential to both the ventricles, resulting into the systole of the ventricles at the same time, and the blood will enter into this ventricle, resulting into ventricular systole. This diagram shows more clear view of the system. Here you can see the sinoatrial node from which the branches passes the action potential to the atrioventricular or the AV node, followed by the bundle of His, the left and right bundle fibers, and the last one Purkinje fibers supplying both the left and the right ventricles. Furthermore, SA node would initiate an action potential about every 0.6 second or 100 times per minute. That is why it is known as natural pacemaker of the heart. Other fibers too have capacity to initiate action potential, but at a slower rate. For example, AV node can initiate spontaneous depolarization at 40 to 60 beats per minute, which is very less than that of the SA node, followed by the bundle of His that will beat around 20 to 30 beats per minute. This rate will not be enough for adequate blood supply to brain. Therefore, artificial pacemakers are transplanted when the natural pacemaker of the heart is not working properly. Moreover, ANS, that is the autonomic nervous system, or some hormones such as epinephrine, can modify the timing and strength of the heartbeat, but will not be establishing the rhythmic activity of the heart. Hope this will be helpful. Thank you and good luck.